Joy has a little bit of a double chin here, and that's what we're going to be shaping for her today. This central part, of course, is where the majority of the fat is, and this is what people will perceive as a double chin when they're looking at you. Eliminating a double chin with liposuction depends on being able to make a really nice contrast between the horizontal and vertical parts of the neck. Contouring the neck requires creating definition in this angle here. The triangle on the side of the neck has a little less fat than the central part, but still has to be shaped. And one last part of the process is taking out a little bit of tissue from back here at the angle of the jawline, which completes the jawline contouring. When people do makeup contouring at the jawline, this is really the effect they're trying to produce. The first area I address is this middle part where the bulk of the fat actually is. Taking out the fat going right up to the jawline is what creates that jawline contouring and definition. There's a very small amount of fat around at the angle of the jawline, but I do address that also because that is a big part of making a nice contour of the whole jawline. In most people, there's a small bulge right above the jawline in this jowl area. How are you doing?
Good.
Okay. So what does it kind of feel like?
Feels really tight.
Like tight?
Yeah.
I take out a small amount of fat from there so that I can even it out with the rest of the cheek, and that also helps to eliminate that little groove in front of it.
How does it feel? It just feels weird.
She just saw herself.
Give a thumbs up that you can see. Now I go to great lengths to inject the local very slowly and carefully so that the patients aren't hurt by the injection itself. By the time I'm actually doing any fat removal, this entire area is completely numb, and it makes the experience very easy for the patients. This little thing is called a biopsy punch. This is what I use to make small circular punctures that heal cleanly and after a little bit of time become completely invisible. Hiding that small puncture behind the earlobe keeps it completely out of sight. And this cannula is what I use to get the fat out. Now if I start right away with the suction on, then the cannula kind of gets stuck to the tissues that are around it. So the first thing I do is loosen this fat up by passing the cannula through it. And then when I turn the suction on, the fat comes out easily and you can see it there in the tube. I really do think when a lot of people have double chin liposuction, the focus tends to be on this central part, which is the most obvious area of fat collection. Without doing all these other things that I'm showing you though, you're missing out on the opportunity to make the neck really look great. I kind of do most of this by feel to ensure that there's a smooth layer of fat underneath the skin. I want to make sure I have a very even layer of fat left behind because it's kind of like padding underneath carpeting. As I was saying earlier, the angle of the jaw has very little fat, but using this small cannula allows some very precise shaping here. It's very important for creating jawline contour to take out enough fat below the jawline and leaving enough above the jawline so you can see that contrast and make it a sharp line. Okay. Am I hurting you? No?
Say something.
So Joy, the shape that you're going to see after this is all healed is actually going to be a lot better than most people will have naturally because these are not areas that are usually that well defined. Okay, did any of that hurt? Say, go like this.
I can't.
Oh, okay, she just said something. I'll go through at the end of the procedure and make sure that I can feel a drop off from the cheek to the area underneath the jaw, which is what's going to create that shadow under the jaw and make it so that it looks a lot more refined. Precisely shaping all of these areas is what gives somebody that crisp, refined jawline and neckline that they're really after. You can already see a little bit of a difference between the horizontal and vertical parts of her neck from the side. So the whole process takes probably 30-45 minutes. It truly is not a painful experience. When the patients walk out at the end, they're always happy they did it.